Hi, everybody. This is part 2, selling and administration of the pharmacogenetic testing training. So let's go ahead and get started. When we're talking about the selling, we've got to understand confidently and competently what we're selling, who we're selling, and who we're selling to. So here we're going to talk about the lab and the prescriber, where and how. So let's cover each of those topics in order. There's an intangible of what we're selling in terms of the concept, because this is, in the first instance, a concept sale, is personalized medicine. So what we're selling to the prescriber is the ability to use precision when it comes to prescribing, genome-informed prescribing. This will allow the prescriber to tailor the therapy to the individual patient using sophisticated molecular tools, which will produce better outcomes and fewer ADEs. And we have to recognize to the prescriber that this is a substantial shift from the typical patient to the individual patient. You've got to cross that bridge. You can't make the prescriber feel as though they've been doing something incorrect, something wrong, because now for the first time, they can know the right drug at the right dose for the right patient the first time, rather than using trial and error, one size fits all prescribing. So this is the concept. This is the intangible component of what we're selling. But make no mistake about it, there is a tangible component. And those are the summary pages, the reports. And this is an example of the pain management summary page from AI Biotech, one of the labs, our primary lab. So again, we have the intangible and we have the tangible. And I think that you've got to sell them on the concept before the details make any difference to them. We work with 2 labs, AI Biotech and AssureRx, 2 of the best labs in the country. AO Biotech has a large staff, 70% of which are scientists. So this is a true genetics lab. This is not a urine lab that decided to move into pharmacogenetic testing because that was a good space to be in. AI Biotech's, AIB's clients include clinical trial support for major pharmaceutical companies. They were the lab that the government contracted with when the anthrax was being mailed more than a decade ago to discern what strain of anthrax it is, and they're called upon to do forensics in capital cases. So this is a highly qualified lab with a worldwide presence, located in Richmond, Virginia, with licenses, registrations, and certifications that are shown. So not only are they a CLIA certified lab, but they're also CAP, the College of American Pathologists. So this is as good as it gets. This is a gold standard, clinically certified in all 50 states. Our supplemental lab is AssureRx, founded in 2006 to commercialize personalized medicine technology, owned in part. A stakeholder is the Mayo Clinic and the Cincinnati Children's Hospital. So they are equity holders as well as technology collaborators. AssureRx has a pain panel, psych panel, ADHD and MTHFR on the psych panel. AI Biotech has a more comprehensive portfolio of tests. They have a cardiac panel, they have a pain management panel, a psych panel, a urology panel, and in the very near future, at the end of January of 2014, a neurology panel. So again, AI Biotech, larger testing portfolio. AssureRx has as its mission the pain panel, the psych panel, ADHD, and MTHFR. And if you watch the first part 1, you'll know what MTHFR is. So who are we calling on? Who is our potential portfolio of clients? Cardiologists, internists, OBGYNs, orthopods, sports medicine, pain management, podiatrists, psychiatrists, but not with AssureRx. They have their in-house stable of sales reps that call on psychiatrists and also no peds, neurologists, urologists. These are the obvious specialties given the panels. Again, the cardiology panel, the pain management panel, the psych. the urology and the neurology. These are the obvious specialties. But if you'll recall from part one, knowing metabolizer status and knowing the pathway that a drug goes down really positions you to speak to specialists in addition to this list, because when all is said and done, this is a metabolizer status test. When it comes to sending tests, because there's more information given on the AID test, it's more comprehensive. Medicare, PPOs, but not Blue Cross and Cash. And I say that because these are the providers that AID will test. So obviously, if you can send a test to AID, that's where you'd want to send it to get the more information. AssureRx is Medicaid in almost all of the states, 2/3 or so of the states. Notable exceptions: no New York, no New Jersey, no Florida, and obviously, in addition to that, there are other states. So you'll want to make sure you check on that. HMOs and Blue Cross. Again, AssureRx has a smaller portfolio of panels. I think it's good to know what you've got to master in order to be successful at any given task. And this is the list here. 10 steps to success in pharmacogenetic testing selling. Obviously, it all starts with training. You want to be a professional. Even if you're doing this part-time, you've got to be a professional. You've got to know what you're talking about. So part one is background in science. This is part two, which is selling and administration. And the third training is paperwork. So you'll want to make sure that you've listened to those more than once. In fact, 5 times, 3 times, as many times as it takes for you to master the learning curve. You want to learn the summary pages of the panel reports, because remember, that's the tangible of what we're selling, which is addressed on part one of the trainings. You want to master the paperwork. This is a concept sale, but you've got to understand how to do the paperwork in order to not get hung up on the details. And that's part 3 of the training. You want to master your power statement, your power phrases. You want to make sure you understand the respective labs' billing policies, the potential for the physician to bill for the interpretation of the test. You want to make sure that you understand how to train somebody to swab successfully, so you've got to know how to do it. You're going to want to be familiar and know the functionality of the 2 labs portals where they deliver the test results. Prepare your selling folder and learn the presentation and the evaluation close. I think that you all know when you're speaking to a physician, you've got to use impactful words, because in a few seconds, you're going to have to get their attention, whether it's in a hallway, in a waiting room. So you want to make sure that you follow the lead of the 11 o'clock news and use those powerful words, those powerful phrases to get their attention. So these are 2 examples. You'll find your own voice, obviously. You'll find your own voice. But I think it's great to start with questions. Would it be helpful to you to know in advance how a patient will metabolize a particular drug? Do you think it would be helpful to your patients if you could select a drug based upon their DNA? Would you like to pick an antihypertensive that's based upon your individual patient rather than the typical patient? So again, what you're selling here, what you're getting the physician's attention with, the prescriber's attention with, is this power statement. You're not going to go into the details until they bought the concept. Examples of power phrases. Now, the power statement is, if you'll use the tennis analogy, that's getting the ball over the net. This is how you're going to keep the ball in play. These are the volleys right here. These are the phrases that you'll use after you've gotten the doctor's attention, whether it's because that you've gotten his attention or her attention and they're going to give you a couple of minutes or 2, or whether because you've scheduled that 10-minute appointment. Quick, simple, easy, convenient, non-invasive. Results are color-coded for ease of interpretation. This is genome-informed prescribing. I won't read these to you, but this is a great starting point. If you can own these phrases, not borrow them, not rent them, you've got to own them. People react to how you're saying something as much as to what you're saying, and then be able to substantiate them. For instance, not doing the test doesn't save time. Someone talks about how long does this test take? Well, it takes 2 to 3 minutes to do, but not doing this test could take a lot longer. And then be able to substantiate that by talking about how when patients call for new meds, the process that takes. Clinically actionable data. This is a great list of phrases that you will want to have. Think of these as arrows in your quiver. You've got to have all of these mastered. Each of the labs have their own billing policy. This is AI Biotech's billing policy, front and back. So you're going to want to make sure that you can accurately, this is critical, that you can accurately describe to whether it's a prescriber or their office staff in what instances a patient will get a bill. So as you can see here, there are only a few instances which you receive a bill from AO Biotech. And this handout, which is contained in each of the test kits, goes over the instances in which a patient may receive a bill from AI Biotech. And it also points out that an explanation of benefits in EOB, which by regulation insurance companies send to lives they insure, that an EOB is not a bill. So again, if you're not familiar with billing and insurance terms, there's a great chart down here, but you will want to make sure that when you get your set of kits that you review this, because you have to be accurate when you're describing it. So again, the 4 instances where a patient would receive a bill from AO Biotech is that if the payment was sent directly to the patient and not forwarded as requested. So if for whatever reason an insurance company sends the payment to the patient and it's not forwarded to AI Biotech, obviously AO Biotech will seek recourse and try to get that money from the patient by sending a bill. If there's no medical insurance, obviously the patient would get a bill. If there's a copay or an unmet deductible for laboratory services, again, unmet deductible, the patient's going to get a bill. Or if the insurance information provided by the physician is no longer in effect, which in effect is saying that you don't have insurance. So those are the 4 instances in which a patient will get a bill from AO Biotech. So for example, Medicare reimburses for this genotyping for metabolizer status test. So a Medicare patient is not going to get a bill because it does not fall within, any of those 4 instances. So again, Medicare, it doesn't fall within one of these 4 instances, so they're not going to get a bill. Commercial PPO, unless there's an unmet deductible, patient's not going to get a bill. So again, make sure you understand this and can say it with confidence. AssureRx's billing policy, Medicaid, TRICARE, no bill. And I'm leaving Medicare off that list by design because, again, Medicare would ideally be going to AI Biotech because you're getting more comprehensive information. All others will receive a bill within the scope of AssureRx's financial assistance program. And for most folks, that means that they'll be responsible for between $10 and $50. Now, these cards, this is a statement of Assure's financial assistance program. The prescriber, the practice receives these with the kits, and every patient should get one of these because it explains, based upon adjusted household gross income, what a patient's responsibility would be. So when the patient gets a bill after the fact from Assure, they will be asked to simply state, it's the honor system, what their AGI is, and then send a check for the corresponding amount. So if an individual's adjusted gross income is $30,000, they'll be responsible for $20 of a payment to Assure. So again, this is what the card looks like and will be given to each patient. And this is a statement of the front and back of the card. So there you can see, again, whether it's $20, $50, $100, or $200. That's what the patient could potentially be responsible for. You're obviously going to want to be prepared for success. You're going to want to set up those sales folders, and we're going to go over each item that would ideally be in the sales folder. You're going to want to have on the right-hand side a summary page from the test results. I put cardiology in the front, moving from front to back, cardiology, pain management, psych, neurology. Now, Practices, make no mistake about it, don't get hung up on this because they won't. They are very used to, in fact, expect to be dealing with different service providers based upon insurance coverage. So the fact that you are coming in to talk about 2 labs is not going to be an issue for them. So don't let it be an issue for you. But what you don't want to do is sort of confuse folks on the front end. So what you can confidently and accurately say, except in the no-fly Medicaid states, is that you're representing labs such that they can test all of their patients, because that's the case again, and except for those handful or so of non-Medicaid states. So you're going to want to have that front to back. You're going to want to have your business card, and these pocket folders are available. You're responsible to pay the cost of shipping, but those are available to you. And on the left-hand side, you're going to want to have the brochure for the personalized medicine panel, which is the most comprehensive. It gives all 4 test results from AI Biotech. You're going to want to have that GPS that we talked about in part 1, and I like those color copied. And you're going to want to have, particularly if you're talking to a cardiologist, a copy of the Coumadin dosing chart, which again we talked about in part 1. Now that's the most that you would have in a folder, and frequently you're not going to go over all of that, but that would be the most you have. I don't go in with articles. I don't go in with studies. Best case scenario, in my opinion, that protracts the sales process, particularly if the prescriber hasn't asked for it and you're just offering it unilaterally. You are on some level implicitly telling the prescriber that they should read this before they make a decision. So that's why I say best case scenario, you're protracting the sales process. So again, these folders and the brochures are available to you on a website that your manager will give you, and you want to print these again in color. So the brochure and the folder you can acquire from the website, paying for the shipping and handling. All of the other items you would want to print, and you want to have these prepared so that if you're fortunate enough to get an appointment, it's at the end of the day and you have an appointment at 8 a.m. tomorrow morning, you're not running around. So be prepared for success. This is a close-up of the pharmacogenetics basics. We've talked about that in part 1. This really sort of brings it home for the prescriber because it allows them to see really how simply they can implement into their patient management the information that you're giving. This is the dosing recommendations for Coumadin. We talked about this in detail in part 1, so you will just want to print these and include them. Again, that will allow you to communicate to the physician that this isn't just you saying this. I mean, I'm always of the opinion, heck, I could be wrong about any given thing, but could Harvard, Duke, Vanderbilt, Chapel Hill, Columbia, Cornell, the NIH, the FDA, the Mayo Clinic, could they really all be wrong? Because remember, doctors don't want to be the first. They don't want to be the last. They like to play follow the leader. This is a great handout. It is available to you. It's a Word document, so you can print your information, your contact information at the bottom of this. And remember, if you're doing a drop by, a cold call, and the office manager asks if you have any information to leave, you might want to think about leaving this because, again, it has your contact information rather than that entire folder, because this is going to be more likely to be read by the physician when he or she has a few moments. And I like this because it really succinctly, it's very effective and very efficient, gives the features and benefits of pharmacogenetic testing. So again, this is available to you. You would just print it, add your contact information at the bottom, and it's sort of a one and done. All of the information is there. Presentation and close, obviously, this is where the rubber hits the road. I am a big believer in name dropping with doctors. And I say that because it's such a peer review driven profession. They care what other people are doing. They care who is doing it. So you've got to be prepared to let them know who else is doing this. And all politics are local. So if you're in the area of Vanderbilt, then obviously that's who you're going to lead with, Vanderbilt. If you're in Metro New York City, then obviously you would want to lead with Columbia and Cornell, who initiated their effort in this space a year ago at the end of this month and called it their Precision Medicine Institute. So again, you've got to know who's doing this, but you've got to lead with whoever is doing it locally, whether it's the Mayo Clinic, Georgetown, Harvard, Beth Israel Deaconess, the Mayo Clinic, Scripps Howard. The point is, this is here to stay. It's not going anywhere. So why not get the learning curve out of the way and let's get started, doctor? It's sort of like EMRs. No doctor did the happy dance when they were converting to EMRs, but the reality is it was there to stay and they had to get it done. So let's get started doing this. A presentation is available to you either in a talking points, because some of us would rather have a conversation than make a presentation, but you've got to know where to get started when you're getting started. So there are bullet points which really take you through the items that you would want to cover in that 10-minute conversation. And you've got to time yourself. What you don't want to do is assume it's going to take 10 minutes and yet you're taking 20 minutes and you're just cutting off the second half of your presentation. So you've got to manage your time, and you've got to be able to communicate the essence of the testing, whether it's in 2 minutes, 5 minutes, or 10 minutes. So you've got to have that short, medium, and longer version, because how many times have you gone in for a 10-minute meeting when in fact schedules have changed and it's not 10 minutes, it's 2 minutes. So understand that you've got to be able to communicate in a period of time you've been given the essential elements of this ancillary. So whether you're using talking points, and there is a script that's available where it's the talking points written out. So I think sometimes it's easier to learn something from bullets, but the script actually sort of puts it in sentences. And then there is a flip chart, a presentation, and it's not either or. I think that it would make sense to have the flip chart with you, because in fact you may want to even just show one of those pages, even though you're more of a conversation person. So find your voice, be comfortable with the flip chart, be comfortable with the conversation, but most importantly, ask up front how much time you have and make sure that you communicate in that prescribed amount of time the essence of the ancillary. I think of two closes. The evaluation close, and they're not mutually exclusive, the evaluation close and the follow the leader close. So if a doctor, for instance, in the course of my presentation were to ask for more information, can you get me some more information? Can you track this down? I like to thank them for their interest, because obviously if they want more information, there must be some level of interest. And I go on to say something like this, and this is also scripted out. Dr. Wood, I thank you for your interest. Obviously, you're interested enough to want more information. But can I make a suggestion? Because I think we know how busy you are and how it may take a while for you to read that article. The suggestion is that I'd like to swab a handful or two of patients. And I may even do that this afternoon if it fits our schedule. So if it doesn't fit your schedule, don't offer it. If it does, do. And if this afternoon doesn't work for whatever reason, I'd like to schedule that before I leave here today, because I think the best way for you to evaluate this ancillary is in the context of actual test results from your patients. So what I'd like to do is swab a handful or two of patients. I'll come back a week or so later. We'll look at those test results, and in the context of actual test results from your patients, you can decide whether this ancillary makes sense for your patients and your practice. And then just be quiet. I mean, think about it. If a prescriber with no commitment on the front end, no commitment on the back end, you're going to do the swabbing, you're going to come back and review the test results. If they're not willing to do that, query whether that's a qualified prospect or not. So I think of that as the evaluation close. Now, even if they haven't asked for additional information during the course of the presentation, you can certainly close that way. It's just an effective close. I mean, it's sort of like dating. You're not asking them to get married. You're just asking them on a date. We're going to do this. You'll evaluate it. It's how do you eat an elephant one bite at a time. This is the first time. Now, the other close that I like is what I call the follow the leader close, because remember, physicians don't want to be the first. They don't want to be the last. And again, they're not mutually exclusive. You can segue from one to the other. Use your judgment as to how you do this. What you can do with, once you've impressed the prescriber with who is doing this, and I always think of it as, all of the medical schools you would want your kids to go to and all of the teaching institutions you'd want them to do their residencies at. They are, to some level, using pharmacogenetic testing. So you too can follow the leaders. I don't use that term, but that's the concept. You too can do what Vanderbilt is doing for its cardiac patients. You can do here in your office, hence the follow the leader close. And we're going to do that with 2 simple steps. I'm going to schedule an in-service. I'm going to train your staff how to swab. It's a relatively simple process. Remember, I told you it only take 2 to 3 minutes to do, so it's not going to take more than 15 minutes to show them how to do that. But I'm going to stay to watch just to make sure things are seamless. That's the first step. And the second step is that I'll schedule a time approximately 7 business days later. I'll come in and I'll go over the test results with you. After these 2 formal sessions, we'll service your account as often as needed to make sure things are running smoothly and you have adequate testing supplies. That's what I think of as the follow the leader close. Let's talk a little bit about the administration, starting with registering the practice. There's paperwork respective to both of the labs. They each have their own set of paperwork that you'll have to master, and that can be done easily in Part 3. Relatively simple. Name, fax, phone number, etc., but it's got to be done correctly. These are highly regulated matters, so you want to make sure that you get that done correctly so that you're not having to redo the forms. It's critical that you have a discussion with the prescriber with regard to the testing protocol. Prescribers know who to do CBCs on, they know who to order stress tests on. This is a new test, so even if they're buying the concept, understanding the detail, thrilled that this can actually be done in their office, you've got to have a discussion, a qualified discussion about what the testing protocol is, because they're busy. They're not looking for additional things to do. And as much as they say yes when you're there in front of them, what can happen unless you actually have this conversation is it just sort of falls between the cracks. Not because they don't believe in the science, not because they don't believe in how it'll help their patient management, just because it's one of those out of sight, out of mind. So you've got to have that conversation with the prescriber. It's got to be upfront. You can't sort of wait for a month after the fact and wonder why there haven't been any tests. And it's a simple conversation. Great, doctor. I'm thrilled that we're going to test a handful of patients. That would be the evaluation closer. Great. I'm thrilled that you're ready to implement this into your practice. Who do you see yourself testing? Because without that testing protocol, you're going to have issues with the number of tests that get done, and you want to make sure that you help as many patients as possible. So if you're asked for a recommendation, which very well may be the case, because to a certain degree they'll defer to your opinion, doesn't mean they're going to accept it. Polypharmacy patients is an example. You can talk to a cardiologist about their Plavix patient or their Coumadin patients, but be prepared to have that conversation. And you've got to have that conversation with the prescriber. So you've got to establish that testing protocol, and you're going to want to make sure that that testing protocol is communicated to the staff, ideally in your presence. So the prescriber's in the room, the key staff people are in the room, and you're in the room. What you don't want to do, ideally, again, is that the prescriber tells you what he or she wants to do. You're left to communicate it to the staff, and they're not hearing it from their boss. So you want that to be a 3-way communication with the doctor present, where you discuss the importance of the test. And I like putting a name on it, talking about how you may even know somebody who took a certain drug and it didn't work for them, or you may even have a family member that they took a drug and they had a side effect, a bad side effect. Put a name, put a face to it, make this real to them. So you're going to talk about the testing protocol. The doctor's going to let them know who we're testing. Are we testing polypharmacy patients? Are we testing patients who are on Plavix? Are we testing? So you want to establish that. You're going to talk about the importance of the test. You're going to describe your role. Your role is to make sure that this is seamlessly, effortlessly integrated into their daily practice management. You're going to talk about how it's a quick, simple, easy, convenient 2 to 3 minute test. You're there to support their efforts, and you want to make sure you're establishing rapport. You're not their boss. They don't work for you. You're there to help them. And then you're going to want to make sure that somehow you establish a system to identify the patients that the doctor has said he or she wants to test. So it could be stickers, it could be Post-its, if they're using paper, if they're using electronic, and there's an ICD-9 code that the doctor's interested in testing, you can search for it that way. But you've got to help the staff create a system that will make it easy for them to, in effect, implement what the doctor has told them that he or she wants to do. You're going to have to become familiar with the requisition forms. So there's the account setup forms on the front end and the requisitions to order a test, just like requisitions are required to order any test. I like using a logbook. There are 2 logbook pages that will be available to you in the Dropbox, one for the non-Medicaid states and one for the Medicaid states. So you would put both of these you would put one of these in a logbook depending upon what state you're implementing in. So it's just simply the date, the patient name, and then the redundant FedEx label goes there. So again, if you're in a Medicaid state, you would use this page, and if you're in a non-Medicare state, you would use this page. You simply print them. I like to print these in color. You 3-hole punch them, and you put them in a 1/2-inch binder, which we'll talk about in a little bit. When you're setting up the account, not only do you have to train the staff, but you've got to observe and make sure that the staff is doing this correctly. If it doesn't get done correctly, that means it's going to take more time, and the staff is going to add up all of this time and this 2 to 3 minute test that you promised, and they'll exaggerate no matter how long it takes because they haven't been trained properly. They'll add on top of that. So all of a sudden it's a 10 or 12 minute test. So this is part of what your responsibility is to train the staff and to make sure that you stay there to observe that it's being done correctly. This is an example of AI Biotech's test kit. The AssureRx is very similar. The contents are in a half-size manila envelope, if you will. There's the coin envelope, there's the actual swabs, there's the requisition, and there is the FedEx label, prepaid FedEx label. For AI Biotech, they use a plastic FedEx envelope. AssureRx uses a cardboard one. So these are the critical contents of a testing kit. This is the cover of the log book, and I like it. Again, you can print this and you buy a 1/2-inch binder and you just slip this in the cover because you want to buy the binder that has the clear plastic front. So when you get the test kit, you're going to peel the swabs using gloves from the stick end, from the non-swabbing end. And you're going to take one of the swabs, and I like pinching that cheek, and again, you have gloves on, and you're going to press firmly. We want to make sure we're picking up those skin cells so that the DNA can be processed in the respective labs. We're going to press firmly for 15 seconds, moving the swab around. And we're going to take the swab and we're going to rest it up against the wrapper. I like creating that little kickstand so that you're not dealing with cross-contamination. You're not lying it on the counter. So you're going to take the first swab that you've rubbed in the patient's mouth and you're going to lean it up against the wrapper that I've turned on its side to make a little kickstand. And then I'm going to take the second swab and I'm going to, again, pressing firmly on the other cheek. And I say the other cheek because we want to make sure we're picking up skin cells. So the best way to make sure you're not in the same spot is to use the other cheek, pressing firmly, 15 seconds, moving it around. We're then going to take the second swab and we're going to rest it up against the kickstand that we've created with the wrapper. And while they're drying, we are going to write the information that the coin envelopes require. AI Biotech is patient name and date of birth. They have to be on there. You have to have redundant patient identifiers. This is one of the things you're going to want to make sure the staff understands. So while they're drying, you're going to write the information on the envelope. AssureRx has an additional element. They want the collector's name. And once you're done with that, it doesn't have to be any drier. You're going to take the 2 swabs and you're going to place them in the envelope that you've completed with the required information. You're going to slide them in. They're scored so that they'll snap off quite easily. And then you're going to seal the envelope just by closing it. You don't want to lick it because you don't want to put any DNA in there that's not the patient's. So now you have the 2 swabs in the coin envelope. You're going to take the coin envelope along with the requisition and you're going to put it in the container envelope, if you will, and then you're going to take that and you're going to put it either in the FedEx plastic envelope or cardboard envelope, depending upon the lab, and you're going to take the prepaid FedEx label and you're going to put that on the envelope. Now, I'm very careful to tell my offices to not worry about the return address because remember, they're going to add up all of the time that it takes. And this redundant FedEx label here, the tracking, is what gets placed in the 3rd column. And they can dispose of this half. So you can see how simple that is. We're really talking about a 2 to 3 minute process. I like to set the offices up. I like for them to understand that this is real and to have a professional situation in the office where the kits aren't just floating around. So you can buy these crates. They're very small. They're, as you can see, they're just a couple of inches wide because the test kits are in them. You can buy them at Walmart. You can buy them online. They're clearly under $2. Lots of times they're under $1.50. And you want 2, one for the AO Biotech kits and you want one for the AssureRx kits. And then you would take this, depending on the state you're in, and put it on the front of each of them, just to remind the staff as to where they should be sending test kits. And then this is a 1/2-inch binder that, again, you can buy online at Walmart, Target, etc. You're going to put you're going to print the cover, you're going to slide it in, and you're going to 3-hole punch your logbook pages and put them in there. And if you're creating a customized requisition, meaning you've completed some of the information for the office, such as phone number, address, etc., and you want to save the master, you could put that at the back of it. So the results are available in 1 business week. Again, because of the AssureRx tests are less comprehensive, those are done more quickly. Let's call it 3 to 4 business days. So you will want to schedule an appointment with the prescriber to go back in and review the test results. And you should do that on day 1 of swabbing because you can estimate as to when the test results will be in. And obviously, if you're going to err, you would err on the side of taking a little bit longer because the last thing you want to do is to go there and the results not be there. There are user guides for both labs. You're going to want to make sure that you review those because you're going to go in to show the physician the functionality of the respective portals, but you've got to show him or her how seamless it is. Like, for instance, with AO Biotech, you really want to be on Firefox because it's such a secure site that you will have a hard time with any other browser. But in the review, their user guides, there are the how-tos for both of the portals. And finally, post-sales support for the account and you. You're responsible for monitoring test kit supply. There are different procedures for the 2 labs. For AssureRx, the office orders it on their portal, but you're going to want to make sure that they know that and you keep track. If they don't have kits, they're out of business. For AO Biotech, the requests are emailed to the company. And you're going to want to make sure that you keep training yourself. This is a profession. This is a highly regulated space, and you've got to stay on top of this. So you've got to keep yourself trained, keep yourself up to date. I didn't go into a lot of detail on the paperwork because, as I said, there is a part 3 to the training with regard to the paperwork. So that concludes part 2. And make sure that you listen to this more than a couple of times because you want to get competent and confident. Thanks so much.